Good day everyone, my name is Roger Banate from BTlet2B, and this is my reflection about 14 categories of students with disabilities. Autism. Autism is a lifelong non-progressive neurological disorder typically appearing before the age of 3 years. The word autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction. And the strategies that we can use in this situation is we need to have environment set a visual classroom, giving information. Think of using visual tools to give information to students with autism, managing time, and support positive behaviors. Deaf blindness is a combination of sight and hearing loss that affects a person's ability to communicate, access information, and get around. It's also sometimes called dual sensory loss or multi-sensory impairment. And the example that we need is have assistive technology equipment like hearing aids and assistive learning device. We need interpreters, note takers, and reading machine for students who are not completely blind. Deafness, partial or complete hearing loss. Levels of hearing impairment vary from a mild to a total loss of hearing. Elderly adults suffer most often from hearing loss. The most common cause of hearing loss in children is otitis media. And the example of strategies for this is includes a visual aids in teaching. Visual aids are beneficial for every student, even the student without any hearing difficulty, by writing down the phrases or using pictures, videos, and slideshows. Not only will help the deaf students to maximum extent, but will also make the session interesting for them. Developmental delay. When a child's progression through the predictable developmental phases slows, stops, or reverses, symptoms include slower than normal development motor, cognitive, social, and emotional skills. For motor delays, your child's doctor may suggest that you encourage your little one to move and be active at home. They may also need physical therapy to help them with movements that use a lot muscle groups, occupational therapy to improve small movement skills or coordination problems. Emotional disturb, an inability to learn that cannot be explained by intellectual sensory of health, an ability to build or maintain satisfactory interpersonal relationship with peers and teachers, inappropriate types of behavior or feelings under normal circumstances. We have six types emotional disturbance. We have anxiety disorder, we have bipolar disorder, we have conduct disorders, we have eating disorders, we have obsessive compulsive disorder, and we have psychotic disorders. Behavior affects educational performance. And the example of strategies is we need to keep class rules, activities simple and clear. Reward positive behaviors. Allow for mini breaks, fair treatment for all, and use motivational strategies. Hearing impairment. Hearing loss, also called hearing impairment, makes it hard to hear or understand sounds. This happens when there is a problem with one or more parts of ear, the nerves coming from the ears of the hearing part of the brain. In this situation, we need to do is make seating changes, minimize background noise when possible, use an FM system, face students when you speak, and use lots of pictures, graphics, and text labels. Intellectual disability. Intellectual disability is a term used when there are limits to a person's ability to learn at an expected level and function in daily life. Levels of intellectual disability vary greatly in children. That's why we need using small steps, modify teaching to be more hands-on, think visual, and use baby steps. Multiple disabilities. Multiple disabilities means concomitant impairments, such as intellectual disabilities, blindness, or intellectual disabilities, orthopedic impairment, the combination of which cause such severe educational needs that they cannot be accommodated in special education program solely for one of the impairments. That's why we need a strategy like Lean and others. Stay organized, don't reinvent the wheel, know that each student is unique, keep instruction simple, and embrace advocacy. Orthopedic impairment is defined as a child's disability relating to a bone, joint, or muscle that is severed enough to directly affect the child's educational performance. People with orthopedic impairments usually need physical accommodation or assistive technology in school, the workplace, and at home. Other health impairment is that the child must have limited strength, vitality, or alertness due to chronic health problems, and educational performance that is negatively affected as a result. Example of this is asthma, attention deficit disorder or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette syndrome. Teach these students specific techniques for organizing their thoughts and materials. Organize the classroom accordingly, and keep all materials in permanent location for easy access. Allow extra time for finishing assignments or for testing. Traumatic brain injury is a sudden injury that causes damage of the brain. It may happen when there is blow, bump, or jolt to the head. This is a close head injury. A TBI can also happen when an object penetrates the skull. This penetrating injury. The strategy that we need to do is avoid figurative language, reinforce lengthening periods of attention to appropriate tasks, probe skill acquisition frequently, and provide repeated practice. Specific learning disabilities means a disorder in one or more of the basic psychological process involved in understanding or in using language, spoken or written, that may manifest itself in the imperfect ability to listen, think, speak, read, write, spell, or to do mathematical calculations, including conditions. In this situation, we can use diagrams, graphics, and picture to support instruction, provide independent practice, and model what you want students do. Speech language impairments are disorder or speech sounds, fluency, or voice that interfere with communication, adversely affected performance and or functioning in the educational environment, and result in the need for exceptional student education. In this situation, we can encourage and accept all forms of communication. Be conscious of your own communication style. Teach active listening skills. Give time to think and respond to questions. And use sound discrimination exercises. Visual impairment is a decreased ability to see to a degree that causes problems not fixable by usual means, such as glasses. Some also include those who have decreased ability to see because they do not have access to glasses or contact lenses. Encourage the students to use visual aids, resources that have been prescribed, glasses, magnifiers, big print books, etc. Seat the student appropriately in the classroom, in the middle towards the front. Make sure lighting is suitable.